Hey, I'm Dr. Reagan, and welcome back to CRxOWN Talks, your dose of health and healing in Black communities. And in about 15 minutes or so, we clear up myths about Black health and break down the healthcare questions you wish you'd asked and the ish they should have told you. Now, in our most recent breast cancer episode, our guest shared that pelvic physical therapy saved her relationship during treatment and allowed listeners realize they had never even heard of pelvic PT. So today we're talking about what it is, who it's for, and why more Black women deserve access to it. So I'm so excited to be joined by Dr. Sha'Rose Erion, the owner of Erion Pelvic Physiotherapy in Huntsville, Alabama. So welcome, welcome, welcome.
Hi, I'm so happy to be here.
All right, so let's jump straight into the rundown. So, as I said, many women have never even heard of pelvic PT, physical therapy. So, what exactly is it and what do you treat?
Yeah, and there are so many and maybe we don't know this or share this enough, but like many other specialties, there are so many different parts of pelvic floor therapy. In general, pelvic floor therapy treats anything in and around the pelvis. So think vagina, think rectum, treat hips, low back, and then anything kind of in that space. Now, the other side of it is we treat things like pregnancy and postpartum, so symptoms associated with that. We can specialize and treat even things associated with oncology, so cancers, whether in the pelvic region or higher, breast cancers, and then really anything uh, that would affect your reproductive organs, bladder, bowels. We work with.
Okay.
Yeah.
All right. So, what's the biggest myth, though, that for people who have heard of it, what's the biggest myth that you've heard about pelvic floor therapy?
I'm about to make some people mad. It's okay. The biggest myth is that Kegels help with everything. I know. I'm shaking tables.
And that's okay because that's a question for later, but I'm going to go ahead and jump straight into it now, right? Because in our conversation, I told you that like I had to have um, pelvic floor therapy for reasons. We'll talk about some symptoms that get people involved in pelvic floor therapy. But for me, my baby was big and I had episiotomy. So for women who have had children, you know what episiotomy is. They cut me on both sides.
Mm-hmm.
So very weak pelvic floor muscles. And I went to therapy and she was like, I said, I do Kegels all the time. She was like, girl, you're doing those wrong. So let's get into it.
Yes. Look, it really is one of those things. We hear about it. I've heard it my whole life. So you stop your flow of pee. That's how you know you're doing it right. And that's one of the things that makes me so mad because when we are letting pee come out, we don't want to ever let it stop when it's supposed to be coming out. Right. Because then we have those other times when it maybe leakage when it comes out and it's not supposed to.
Mhm.
So with Kegels, that's right. You want to make sure you're doing them properly, but also you want to make sure they're appropriate.
Mhm.
So the important thing with Kegels is making sure you do that tightening and you're able to lift up, but the release is also super important, right? So you need both. You need to be able to let it go up and hold and then come down and release where we need it to, because that's truly how our pelvic floors work.
Yeah. And I know for me, my PT was like, you're using too much of your core. So the core is doing the work. Not core strong either, but
We getting into it. Okay.
but if is that true? Like you're pulling from the wrong place too.
Yeah. So
Yeah.
you can, because the pelvic floor muscles are teeny tiny muscles, and when we think about them, they try to get the bigger muscles to help us. So sometimes our quads help, our core, and then our glutes. Okay. And if you like me, you got some big old glute muscles back there. They will help. And sometimes they got to release and let the pelvic floor do what it's supposed to do. So when you do it, you should feel the movement within your that perineum space, like right between the opening and your rectum. And then you want that space to kind of lift a little bit and release. But you don't want your glutes to do it. You don't want your core to do it. You don't want your quads to kick on. You want just that small little lift. It doesn't have to be big.
Now, how many of y'all out there listening are doing it? I was trying to pull, and she was saying, "Don't." If you think that you may be doing, we got the options for you. You can go to pelvic PT. We're gonna tell you how in a second. But first, what symptoms might make someone think, "Oh, maybe I need to go see a pelvic physiotherapist"?
I'll tell you the more common ones, and then I'll tell you the ones that are not as common, but you should still go see a pelvic floor therapist. So the more common ones are pain with intimacy. So, say you're trying to have a good time with your partner and it's painful, you need to go see a pelvic floor therapist. You're trying to insert a tampon, you definitely need to go see a pelvic floor therapist. You're having your pap smear, your yearly pap smear, and it's painful or uncomfortable, go see a pelvic floor therapist, right? So maybe those you don't necessarily think about. The other side is leakage, right? If you're jumping, sneezing, laughing, coughing, and you have any kind of leakage, okay? Come on, friend. Come on.
But you're right. It's like, come on in, friend. It's it's your turn to come on in. Okay. So we talked about Kegels. What other tools or therapies might help besides Kegels?
Yeah. So tools like breath work. So we all are breathing, right? That's how we're alive. So we might be like, I know how to breathe, but do you? Because a lot of us breathe really shallow, like really
Mhm.
into our chest. And so breath work is a huge way to help with your pelvic floor. So breathing deep into your belly, allowing your pelvic floor to move down like it's supposed to, and then come up as we breathe out. That's a tool. That's a free tool. We got free air. The other thing is coordination. So being able to tighten when you need to, release when you need to, that is actually something that is more important for us than strengthening, if we're being
Right.
honest. Yeah. So being able to hold something, hold that pelvic flare up when you're coughing and sneezing, and then being able to release it, like when you go to the bathroom,
Yeah.
that's actually important. And then of course we have actual tools that you can purchase and that maybe use. So things like dilators. If you're having any pain or things with intimacy or using a tampon or your pap smear, dilators can be really helpful to help just teach your muscles to release when they need to and then be able to kind of come back when you don't need them to.
Hmm. Okay. I was listening to see what you say. What's those all those balls that people were getting for a little while? Everybody was the weighted balls.
Yes. Why are we walking around with those Kegel weighted balls inside of us?
We ate because I tried one. It,
Yes, those were very popular and they still kind of are. And the idea sometimes is, well, if I'm having leakage or if I feel like I can't, pull up my pelvic floor, then it has to be weak.
yeah.
And that's not necessarily the case. It can be really tight. And
Mm,
weakness and tightness often go hand in hand.
mm. That's
So
really good.
yeah. So just like, if we're holding our muscle up here and like we got all these grocery bags, we cannot put any more weight on it.
Yeah.
So sometimes our pelvic floor is just like that. Like it's holding so much, it cannot release when you need it to.
Okay. That's very helpful. Thank you for sharing that. Now, as I mentioned, our previous guest shared how pelvic PT kind of changed her life during her breast cancer journey. When should cancer survivors or even people who are in the midst of the journey
Yeah.
consider pelvic floor therapy?
From the moment, honestly, um, physical therapy is actually a preventive medicine, right? We are movement specialists. We know things that we can predict enough, or we have these ideas of how certain conditions progress to be able to say, okay, well, we're okay now, but we know that maybe this weakness is going to happen, or maybe this inability to coordinate this muscle is going to happen. So we start putting things into place to prevent some issues that can come from that when we don't know.
Yeah.
So definitely beforehand. And then there's never a time that's too late either. So during your treatment, as long as it's appropriate, you can definitely see and work with a pelvic floor therapist. There are pelvic floor therapists who specialize in oncology.
Hmm.
Yeah. Just like any other specialty, they specialize in oncology. So they not only are familiar with the overall body, muscles, and tissues, they're very, very specific and familiar with the pelvic floor. And then the also treatments and things that you may be going through with cancer and treatments like that.
Awesome. That's really great to hear. So if you need it, it's there for you.
Yes.
But we still don't go. So why aren't more women, especially Black women, either being referred to
Mm.
for therapy or just not going in general?
One is a big issue of marketing.
Mm,
Like, if I could take out a billboard in every city possible, I would, right? Marketing is a huge part. People don't know it exists, and they
mhm.
don't know the just range of things that can be helped with pelvic floor therapy. by the time women, especially Black women, make it to pelvic floor therapy, it's usually seen as a last resort.
Yeah.
They're like, I mean, I've given you all these injections, I've done this surgery, I've given
Right.
you all this medication. Now I'll send you to therapy, see if it works.
Yeah.
And what we find is within the first 1 to 3 visits, it does.
Wow.
It does. And it's just such a consistent story. So part of it is people don't know, not from their own, any lack of awareness from them, but providers don't know either.
Mhm.
So the people that we trust to give that referral, they don't know what all they could give a referral for,
Right.
or they don't necessarily trust it, which is fair. Um, but that would be a big part of it. And then Black women, of course, we can't ignore the just historical precedent for why Black women don't trust the healthcare system.
Mhm.
Right? It hasn't necessarily been a place for us to be trustworthy of.
Right.
And so finding someone who will listen to you, who won't tell you it's just in your head, that will, not make it seem like you're just looking for, drugs or something like that is really difficult.
Yeah. And as much as this podcast is for the Black community, it's also for providers. I have a lot of provider listeners as well, primary care, that kind of thing. And so I want them to also understand that
Yes.
these options are out there and available, and you should be prescribing. Like, no one should be asking you for this information. You should be referring to the pelvic person in the pelvic floor therapist in your area. If you don't know who that is, look it up. Okay.
Come on.
But can you self-refer, or do you always have to have a referral?
It depends on your state, which is so frustrating. So where I am here in Alabama, we do have direct access, is what it's called.
Okay.
When you don't need a referral, direct access, you go to a pelvic floor therapist, and you say, "Hey, this is what I'm coming in for," and you don't need a referral for it. Um, Prior to, I think it was 2 years ago that changed. Prior to that, you would have to go to your doctor, get a referral, and
Right.
then they would, send you. So it depends on your state, but you do not need a referral. So even if you go to a therapist, they will say, okay, you do need a referral, but we may be able to get like 1 or 2 visits in before you have to see your doctor.
Okay.
So I always recommend go to them, go to the clinic, go to the therapist, say this is what's going on, and they will make sure you get if you need a referral, they'll give it, get you to the person to do that. Or if they're like, no, we're good, they can start treatment.
Okay, perfect. And so payer source, right? So this is with people with insurance. Are there options for people who don't have insurance, or have Medicare or Medicaid, or
Yeah, so that's for folks who have insurance and don't have insurance. Medicaid is, again, that's going to be state dependent. It's one of my, if I get on a soapbox about anything, it's Medicaid coverage, okay?
Yeah.
Because
Fair
our
enough.
families, listen, our families need it.
Mhm.
And the way they don't want to cover it is absolutely ridiculous. So Medicaid is a little different. You will have to find a provider who accepts Medicaid. Even if you're in the financial space to pay out of pocket, unfortunately, Medicaid has rules in place to where we cannot, if we're not a subscriber with them, we cannot accept money from someone who has Medicaid.
Wow.
Yeah, so I'll tell you this a whole soapbox itself.
Yeah.
Um, but so there are very qualified and intentional and beautiful therapists out there who do accept Medicaid, and it is covered. Pelvic floor therapy is covered under it.
Okay.
Yeah.
Great. Now, many of our listeners are going through perimenopause and other life transitions. How can pelvic floor therapy improve intimacy, confidence, and just right day to day? Oh, this is my space.
Okay, I like to say I specialize with TMI, um, because like people say this is never too much for me. I promise you, I'll go get all up in your business. I want to know how you doing it, how often, what positions, because it's important. It's a quality of life thing.
Mm.
So especially in that perimenopausal place where we know our bodies are shifting a little bit, hormones don't show up in the same quantities maybe they used to. Dryness can be a concern, mood swings. That's a great time to work with the pelvic floor therapist. Um, because lube, okay, is great. Well, I love lube. I have my own personal one that I created. But okay, I did have to drop that in there. Um, but it's not the only thing that can help with those intimacy things, right? Intimacy isn't necessarily just a physical thing; it also is a mental and psychological thing as
Yeah.
well. So we want to make sure all of that is in order when we're talking about it. So taking care of the body first, making sure that there isn't any physical tightness or restrictions, especially around those little tiny muscles, things that go to our clitoris. We have muscles that go around there. We want to make sure all that is nice and released when it needs to be and tightened when we want it to be. And then we want to make sure that we understand what we want within that intimate space and we can communicate that and we can allow it in also. So that's a great place and time, any type of intimate things. I work with people who wanted to try different positions. I work with people who want to try different, orifices, for lack of a better word. And we work on all kinds of things because it is a quality of life thing.
Yeah, for sure. And I get, I always drop this into every episode, something about intimacy, because I don't think we talk about it enough and we have this shame and stigma around it. But if you're unhappy, then your partner may be unhappy too and don't know how to support you through whatever is happening if we're all so concerned about how we discuss intimacy.
Yes, I love it. Thank you for including that.
All right, now we're going to jump to rapid fire. So, first thing that comes to mind, one symptom women ignore for too long.
Leakage,
Mhm.
leakage,
One everyday habit that weakens the pelvic floor without people realizing it.
holding our breath.
Oh my God. Plus, people should be cautious about, because sometimes you hold your breath, you don't even know that you're holding it. One exercise people should be cautious about if they have pelvic floor issues.
Ooh, that's a tough one. Okay, one exercise. Say squats.
And that was a question that I skipped just for time, but about like everybody's doing all these workouts and stuff like that, and how we have to be careful that your workout does not impact your pelvic floor. Anyway, a bathroom habit people should stop doing today.
Stopping their flow of pee.
A pelvic habit everyone should practice.
Pelvic tilt.
Oh,
So, nice little tilt back.
I'm doing it now.
Okay.
Okay. Now, and this is one that I want to start including on all of our episodes. I do episodes about Black women, Black people. What should we be telling our teenagers that are coming up into womanhood?
Oh my goodness. I love this question. The truth. Let's tell them the truth. Let's give them the education. Let's tell them about their bodies. Let's allow them to ask questions and explore those things. Let's allow them to grow into the women that we want them to be, but educated.
Mhm, mhm. Thank you, thank you, thank you for joining us today. But before we close out, for someone who feels nervous or unsure, what should they expect at their initial or first appointment?
That's such a great question. First of all, share that nervousness. Let your therapist know I'm feeling a little uneasy about things because no therapist should put you in a space where you feel uncomfortable anything you're doing.
Yeah.
Right. So share that. So what you should expect is the first visit is usually a bunch of information gathering. We want to know your history. We want to know what brought you in. We want to know how potentially some things might have led to this, or this just came out of the blue. You may get a pelvic floor exam if you're comfortable with that. If you're not comfortable, you never have to have a pelvic floor exam. That's a very important thing I want you to know, because there are so many ways for us to treat your pelvic floor that is not being directly in it. So, and then after that, of course, you talk about what your plan is going to look like. So, you should have an idea of what maybe the next 3 to 6 months might look like within recovery or exercises and things like that. And then making sure that you feel comfortable and you sign up on it. And then you go off from there.
Thank you. That's really important for like what we keep saying about trauma informed care, right? Because a lot of people, or not a lot, people may have some reservations about any type of touch in that area. So it's
Absolutely.
always great. Well, that's it for us. Thank you so much, Dr. Arian, for joining us. And I'm so, so, so ecstatic. Hopefully you'll come back and talk to us again sometime about more information. But for everyone out there, this has been your check in with Crown Talks. And so if you love this, like, share, and subscribe, and consider yourselves Black, healthy, and crowned. Yay!